I am so sorry we have to meet through these circumstances. We want you to know that we are only here for you, and everything that we do in this room is completely in your control. We will not move forward unless you are comfortable with it. Coming here was a major step, and this is one of the best decisions you can make for yourself. We ask for a vague description of what happened. We only need to know enough to accurately collect evidence. Depending on the kind of report you make, the examination process will differ. Adjustments to the patient's examination can be made according to their comfort level. For example, a patient who does not want evidence gathered, either to not report or to place a third-party report, will receive a regular examination. You do not need to make a report to be examined. A diagram is provided in the evidence kit. Based on the description of the assault, we will mark down where on the body we need to evaluate and where we can collect evidence, should the patient choose to do so. For those who want to file a report or feel better knowing the evidence is gathered, should they choose to follow through with a report, we will collect evidence with this kit. We will hold this evidence for up to 6 months. For the evidence kit, we can take photos of any bruises or injuries. For premature injuries, we use a blue light to see them coming up from under the skin so they can be recorded. We will comb through the patient's hair and collect samples. There can be a genital vaginal swab, but that is up to the patient and their comfort level. The hospital response worker will be with the patient the whole time, if that is what the patient wants. This is to ensure the patient is never left alone and has someone to comfort them and speak as their advocate. If you are coming directly from being attacked, or you've come later but have the clothes from the time of the attack, we can use those for evidence as well. At the hospital, we also offer STI testing for regular examinations and as part of gathering evidence. If necessary, we can also provide pregnancy and STI preventative medication as an option for the patient as well.
If you are a victim of sexual assault, there are a few things that may happen in the first few weeks. You may experience intrusive thoughts, unexpected bursts of crying, a higher alert for danger, and soreness. This is all normal. There is no right way to react to trauma. You may also experience triggers that you are unaware of. It could be a smell such as cigarettes or a cologne your abuser could have been wearing. It could be someone touching you, seeing an object that was in the room during the time of the assault, a song or a voice, or a taste from anything before or after the assault. You may be hypersensitive during the first few weeks, and it is important to remember that there's nothing wrong with you for feeling these things. If this has happened to a loved one, you may notice they have a lack of interest in socializing, a fearful response to touching, poor self-care, onset anxiety or depression, sometimes a need for constant companionship. There may be physical indicators like fatigue, nightmares, a loss of appetite, and bruising or bleeding. Sometimes they may take comfort in unhealthy coping mechanisms like substance abuse, eating disorders, or self-harm. The important thing to remember about sexual assault is that this is never the victim's fault. They are not to blame. It doesn't matter what you were wearing, it doesn't matter how much you had to drink, it doesn't matter if you've had sex with the abuser before the assault. Your body is your home and somebody has broken it. Your anger, your fear, your sadness is all valid. Don't question yourself. Don't apologize for your emotions. Heal how you heal. It's okay to be confused. It's okay to feel happy one day and upset the next. Healing is not a linear process. And for everybody listening, if someone tells you they've been sexually assaulted, listen to them. Believe them. Sexual assault is a scary topic and many shy away from it. Be the open door a victim needs to feel heard.
My big foundation beliefs is that the worst has already happened. And now there are people who can step in and start making change from there, to offer that support from there. So the worst is over. Now we're in a position to offer choices and support.